Everyone welcome. My name is Evgeny Rusakov and you're watching TVP World, interview from Vilnius. On the 14th of August 2024, the World Health Organization declared the spread of monkeypox a public health emergency of international concern. For many months now, events have been unfolding in an alarming scenario. To discuss this disturbing topic, we are joined today by the former director of Center for Communicable Diseases and AIDS, Professor Saulius Čaplinskas. Hello, Saulius, and thank you for joining us today.
Hello.
So, this monkeypox, could you please first explain what is this and how dangerous is it?
Okay, monkeypox is viral disease caused by virus which belongs to the same virus group as smallpox. Everybody knows probably smallpox, like very dangerous, contagious, and so on disease. So this virus belongs to the same virus group, but is less contagious and can cause less severe disease. The name monkeypox already presumes that this virus was first discovered in 1958 among monkeys. But later it became clear that the main reservoir where this virus circulated is rodents. It's in wild nature. First human case was discovered in 1970 in Congo, Democratic Republic. So now the question how this virus is spread. So mainly it's like zoonosis. It means that people in this certain area, especially in certain African area like West and Central Africa, in this area some animals, first of all rodents, and not only them, even monkeys for example, could be infected and they could transmit virus between each other, okay, animal to animal. The same time human could be infected, usually by animal body fluids or skin lesions. It means during direct contact, okay, with animal or animal secretions. The same human to human could transmit in close contact via lesions or via air droplets, especially in close, longer contact, breathing face to face, or via contaminated some surfaces. Okay. First of all, bed, clothes, and so on.
What are the first symptoms of that monkeypox?
The first symptoms usually...
Does it look like smallpox, which you've already mentioned?
Yeah, but it's some difference from smallpox. First of all, initial symptoms. Usually they appear in 5-21 days from exposure to virus. And first symptoms are like flu-like symptoms. But like main first symptom is high temperature.
How high? Like
usually it's 39 or even could be more and so on, with chill and so on. And at once would be headache, muscles pain, back pain, by the way, and swell lymph nodes. So difference from smallpox, usually not typical for smallpox, would be swell lymph nodes.
I see.
And rash. Rash could be similar to smallpox, but rash is one of the main symptoms which at once should give idea or like emergencies that probably you have this disease. Yeah.
Okay, I see.
And rash typically appears in 1 or 3 days after high temperature, after fever. And rash usually pass from maculas, papulas, vesiculae, pustules, and scabs. And what's important is that until last scab disappeared, person could be infectious. Still could be infections and pass virus to another. So that means that all this progression, rash progressions from first, usually they appear in face and then go down to all part of the body. A person could be infectious about 2-4 weeks.
Oh, really?
So, and disease, takes about 2-4 weeks.
Okay. So, Saulius, let me ask you this question then. You've already mentioned that this virus has been known since 1958. So why has a virus that's been known since then became so active at this specific moment?
Even philosophically, we could say that if we behave against nature, so then nature punishes us.
Okay.
Now, if to explain, so usually different group of virus exist in nature, and certain animals have certain virus which they adapt to live together, like co-hosting. And let's say so, in last decades and so on, more and more people are going into wild nature. So more contacts with wild nature, more contacts with wild animals, more possibilities that you could contact with infected animal, and probably you could transmit the virus. So let's say one group of reasons. Then world became very small. It means very quickly now we move from one continent to another, and in this case, one infected person from endemic area could bring virus home, could bring virus to another area. Plus climate change and all other things, changing environment, better possibility, let's say so, for rodent family to spread. Yeah.
Okay. That's interesting.
Like complex of different reasons, of different factors, lead to the possibility that virus start spread much quicker.
So do you want to say that literally because of climate change, some diseases that we didn't have here in Lithuania, in this region, at some point may come here as well?
Absolutely, and not only question about this monkeypox virus.
It's just a question of time when it
about
comes
monkeypox, we could come later, but now let's discuss that, for example, mosquito-borne or different insects transmitted disease. Because of climate change, for example, now those diseases spread more to the north or more to the south.
They change their areas, and that's how those viruses just literally travel here.
Absolutely. And if to speak about monkeypox or mpox, now new terminology, just meaning probably a little bit less stigmatization, not monkeypox, but from monkey mpox.
Okay, mpox.
Mpox disease. So our first goal could be not only discuss about how dangerous this could be for me, for my family, and so being here in Lithuania, but main goal probably could be just to give support for Africa, to give vaccines for Africa, not to allow the virus to spread to another part of the world which are not endemic yet.
Exactly. Well, we'll come back to vaccines a bit later. So could you please tell me what are the most vulnerable groups and who gets mpox the hardest?
The hardest are those who have the weak immunity. Weak immune system would be, let's start from young children. Their immune system still is developing, not completely developed. For them could be dangerous. Then for pregnant women, immune system works a little bit different and so on. It's very stimulated. For them could be dangerous. And for those who have different immunodeficiency, like HIV-infected people, like people from organ transplantation, from other chronic disease, and for sure elderly as well, because for older people, immune system is going a little bit down. For them, monkeypox could be more severe.
It could be lethal.
And could be lethal only, the lethality from mpox is from 1 to 10%. But what is important is that from in West Africa strain would be about 3%. In Central Africa strain which circulated, lethality could raise up to 10%. No, for sure, it depends on healthcare system for that country as well, but especially from the host, from the immune system of infected person.
Okay, so now we've already mentioned vaccines. So what about vaccines or rather medicine? I mean, Are the smallpox vaccines effective from this mpox?
Yes, about 85% effectivity smallpox vaccine against mpox. But what's important to mention is that smallpox was eradicated in 1980, and then vaccination stops. So those who are younger, they don't have vaccine, so don't have this vaccine-made immunity. For us who are older, still we have some kind of immunity.
Okay, okay. So now probably the main question. So what is happening to the world, and are we on the brink of a new epidemic?
So to answer to that question, we need to understand the way of transmission, the possibility to react, and so on. So if to conclude, this virus is not so easy transmitted like COVID or like flu. So that means that we don't have really danger that it could spread so quickly. But as I already mentioned, this virus is less severe, less dangerous as smallpox, but still it's quite resistant, and even belongs to the group of the viruses which could be used as biological weapon, let's say so. But now the world have possibility to make surveillance. To make surveillance, to make quick surveillance, quick response, mobilize society, and so on. And we have all possibility not to allow to have epidemic like HIV or like COVID, for example.
What main rules should we follow to avoid getting this mpox?
Probably the first rule, because now the main danger to get, or real possibility to get mpox is if we travel to endemic area. So that means traveling, usually probably traveling during vacation.
Okay.
But in vacation, generally probably we are more relaxed, and sometimes we don't think about dangers which could be during our vacation or business trip. So that means that first of all we need to realize which country we are going to, what kind of specific situation exists in a certain country. And in this case, we are talking not only about mpox, probably some other endemic diseases could be as well. In this case, in some cases, we should get vaccinated. In some cases, you even not allowed to go to the country, for example, from yellow fever, if you will not get vaccination. For mpox, there is not a reason to get vaccination for travelers.
Okay.
But traveling, we need to take care for generally hygiene, for hand hygiene, trying to avoid close contact to person, especially if this person have rash or looks like flu-like symptoms, and for sure for food and drinks hygiene as well. Another idea could be just to get like traveler's kit. Traveler's kit, I mean to have disinfectants for hand, masks if needed, thermometer, some probably medicine for certain lesions or for some other purpose. And that's it, and not get completely relaxed during traveling.
So what's the point of vacation then if you don't get completely relaxed?
If completely relaxed, so probably that could be a bad vacation, and after vacation you need to go to doctor
to check it. Okay, so what would you suggest to those who are planning a trip to Africa at this specific moment?
Why not? But only to look for the information in the Ministry of Foreign Affairs webpage. I mean, what certain changes, what certain regulations are for one or another country, and plus, for sure, it would be a good idea to have phone contacts of our embassy, of probably doctors, of healthcare facilities, and for sure, not to forget insurance.
Well, that's a good advice. So, Saulius, thank you so much for letting us all know what is this mpox, and people take care, I guess.
Thank you for inviting.
Thank you, thank you. And I would like to remind our viewers that our guest for today was a former director of Center for Communicable Diseases and AIDS, Professor Saulius Čaplinskas. You're watching TVP World. Stay with us.